So for lacerations, you're gonna need gloves of some sort, either latex or nitrile gloves, your saline or potable water solution, whether it's potable water or soap and water, Neosporin or any type of ointment or cream that may or may not be used depending on the type of laceration. Bandages or your band-aids or your dressings that you would use, gauze of some sort, and then you also are going to need cleansing wipes. So beginning with your laceration wounds, your first step would be to apply your gloves and any universal precautions. So I would be putting my gloves on before I deal with the wound. Once I apply my universal precautions, then I'm going to try to control the bleeding before I do any dressing of some sort. So you can use gauze. You want to apply direct pressure to the wound. So applying direct pressure. If the bleeding continues or if it's ongoing, you want to control the bleeding prior to you moving to cleaning it and dressing it. So you don't want to remove the gauze or whatever you're using to control the bleeding. You want to apply direct pressure, and then if you need to, if it continues, you would just add more gauze to it until you've controlled the bleeding. After the bleeding has stopped or you controlled it, you can remove all your gauze. You can make sure you have something around, maybe like a biohazard bag or maybe a towel or something, so where you can put your soiled napkins and linens of that nature. So once you remove the gauze, you will clean and debride the wound. So cleansing can be used with either saline or potable water or like a soap and water solution. Wound, you want to debride the wound. You don't want to scrub or swab. You want to use maybe a syringe or something of that nature to shower or spray your wound. You can use, like I said, water or a soap and water solution or saline solution. And when you're debriding it, you want to make sure that whatever you're using has a pressure or a PSI between 4 to 15. You're going to clean the wound twice the length of the wound. So the wound's about 1 inch. Of course, you'd clean it about 2 inches, but you can gauge. But you would clean twice the length of the wound. You clean to dirty, and you can use cleansing towels or something. So after you've cleaned and debrided your wound, you can move to dressing it. So ointments may or may not be used. I guess that would be up to your discretion, but you could apply ointment if you're going to use that, using an antibiotic type of ointment. So apply your ointment, and then you would apply Band-Aids, obviously suitable, the right size for that wound. So you don't want to put a too small of a Band-Aid to where some of it may still be open. You want to use a good enough size for your wound. Once you've done that, if they are going to return to play, you can wrap it securely. So you can use like steri strips or something of that sort, maybe even an ace bandage to wrap it, so that way they can play if they're not, if it's not that serious of a wound. Once you, if they are returning to play, you just want to monitor them, give them some instructions as far as how to take care of it. If it is serious, or even if it's not serious, you do want to refer lacerations to someone else, a physician, or to get further evaluations. Within 10 hours, you really want to do it, try to immediately if possible, but the cutoff for that is within 10 hours. They don't suture after 10 hours. And then, watching for signs and symptoms, give them care instructions, and then referring. And then you also want to refer if it's been 5 years since they've had their TB shot. Signs and symptoms to watch for when you're dealing with lacerations that could mean a possible infection or something else may be going on is any redness, any swelling, any pain, any pus that may be oozing from your wound as well, and any elevated body temperature as well are all signs and symptoms that if those continue to occur, if you see those, then you should go see the doctor to make sure that nothing else is not happening and that the wound is also not infected as well. And while you're at home, you want to try to keep the wound as dry as possible. You don't want it to get wet or get moist. If it does, you want to change the dressings, but you want to keep it as dry as possible. And those are your steps for laceration.